How to treat these STDs: syphilis, herpes, gonorrhea, chlamydia. Medium. Managing sexually transmitted diseases, STDs, necessitates a comprehensive strategy that encompasses precise diagnosis, efficient treatment, and subsequent care to address symptoms, prevent transmission, and mitigate potential long-term health complications. In the following discussion, we provide detailed information about many specific sexually transmitted diseases, STDs, syphilis, genital and oral herpes, gonorrhea, and chlamydia. We cover their respective descriptions, symptoms, diagnostic tests, and treatment options, including the names of medications and the recommended duration of therapy. Syphilis. Definition: syphilis is a bacterial infection caused by the microorganism Treponema pallidum. It advances through many phases and can lead to enduring effects if left untreated. Symptoms and presentation. Initial symptoms consist of ulcers at the site of infection, a skin rash, and symptoms like those of influenza. Jarisch-Herxheimer reaction in patients infected by spirochetes-like syphilis who have been treated with antibiotics. Without treatment, it can advance to impact the cardiovascular system, central nervous system, and other bodily organs. Laboratory testing and screening. Screening entails the use of blood tests, such as the Rapid Plasma Reagan (RPR) test, which is then followed by confirmatory testing like the Fluorescent Treponema Antibody Absorption (FTA-ABS) test. Treatment. The preferred treatment is penicillin G, which is given through an injection into the muscle. The amount and duration of treatment vary according on the stage of syphilis. For early-stage syphilis, a single dose is typically administered, whereas for late-stage syphilis, 3 doses are given at weekly intervals. Post-treatment monitoring. Patients should have additional blood tests at 6, 12, and 24 months to verify the eradication of the infection. Genital and oral herpes. Overview. The presence of 2 forms of herpes simplex virus, HSV, namely HSV-1, often known as oral herpes, and HSV-2, mostly associated with genital herpes, is responsible for this condition. Symptoms and presentation. It manifests as painful vesicles or ulcers on the oral or vaginal region. Outbreaks have the potential to reoccur periodically. Laboratory testing and screening. Diagnosis is achieved by doing viral culture or PCR tests on the sore. Additionally, blood tests can be utilized to detect previous exposure. Treatment. Antiviral drugs such as acyclovir, famciclovir, and valacyclovir are employed to control outbreaks and minimize the risk of transmission. The treatment can be either episodic or suppressive, depending on the frequency of outbreaks. Episodic treatment refers to treating the outbreaks as they occur, whereas suppressive treatment involves taking medication every day to prevent outbreaks from happening. Post-treatment care. Consistent follow-up appointments are crucial for effectively managing recurring symptoms and making any adjustments to treatment programs. Gonorrhea. Definition. Gonorrhea is a bacterial infection caused by the microorganism Neisseria gonorrhoeae, which primarily affects the genital tract, mouth, or anus. Symptoms and presentation. A significant number of patients do not exhibit any symptoms. Common symptoms may encompass dysuria and genital discharge from the penis or vagina. Laboratory testing and screening. Nucleic acid amplification tests, NABAT, are frequently employed to detect the presence of genetic material in urine samples or swabs taken from the affected area. Treatment. The standard course of treatment for this condition is ceftriaxone, an antibiotic that is administered through injection. It is commonly used in combination with azithromycin or doxycycline to provide coverage for potential co-infection with chlamydia. Post-treatment monitoring. It is recommended to undergo a test of cure 2 weeks after treatment, particularly for cases of pharyngeal gonorrhea, as there is a greater chance of treatment not being successful. Chlamydia. Overview. This sexually transmitted disease, caused by the bacteria Chlamydia trachomatis, is the most often reported among all STDs. Symptoms and presentation. Frequently lacking symptoms, when they do occur, symptoms may encompass vaginal discharge and dysuria. Laboratory testing and screening. Nucleic acid amplification tests, NAATs, are the most recommended diagnostic tests, utilizing urine samples or swabs from the vaginal area. Treatment. Azithromycin, administered as a single dose, or doxycycline, taken twice daily for a duration of 7 days, have proven to be effective therapies. Post-treatment monitoring. It is advisable for pregnant women to undergo a test of cure around 3 weeks after therapy. However, for individuals who are not pregnant, a test of cure is not typically recommended unless symptoms continue. Key factors to consider for post-treatment care. Follow-up care is essential for all sexually transmitted diseases, STDs, to maintain treatment effectiveness, prevent transmission, and address any potential consequences. Patients must refrain from engaging in sexual activity until both they and their partners have received treatment and achieved a complete cure in order to avoid the risk of reinfection. It is crucial to provide education on safe sex practices and promote regular screening for sexually active persons, particularly those who engage in sexual activity with numerous partners, in order to effectively prevent the spread of sexually transmitted diseases, STDs. This review offers a comprehensive outline of the treatment for individual sexually transmitted diseases, STDs. Nevertheless, therapy procedures are subject to modification in accordance with the most recent medical research and guidelines. Seeking guidance from healthcare professionals for the purpose of diagnosing and treating specific cases is of utmost importance.